Hi everyone, myself Mrs.Madhubala. I am working as a nursing tutor in E.S College of Nursing. So this presentation is about the personal protective equipment. So shortly we are all called PPE. PPE otherwise known as personal protective equipment. So about this, in healthcare settings, personal protective equipment refers to the specialized clothing or equipment used to prevent the spread of infection, including gloves, gowns, facial protections. Facial protection is mask and eye protections and respirators. So this PPE is very important in our healthcare settings for our healthcare peoples. Without PPE, we can't survive in hospitals. And if we are wearing the PPE means we can prevent the infections. It may be bacteria, virus or anything, and if we protect ourselves. What is PPE means is a barrier that protects the healthcare workers from exposure to infectious agents and also prevents the transmission of microorganisms to other individuals, including staff, patients and visitors. So we can prevent transmission of microorganisms to other peoples also. And we will see one by one what are all the PPE in. And first one is head protectors. Head protector is nothing but is a surgical caps and hoods. So this mainly used during surgical procedure or in aseptic manners. So these devices offer head contact transmissible pathogens. They also allow hair to be covered and avoid potential contamination of the surgical wound. So through these caps and hoods we can prevent infection to the patients. And another one is face shield. Face shield, the face from the various foreign substances and infectious agents. So this face shield protect the wearer. They typically cover all vulnerable places on the face such as eyes, nose and mouth. So in our face, eyes, nose, mouths are vulnerable. So we can prevent infection through this face shield. So this is pictures. This shown the face shield. This is another pictures. So we want to wear the face shield above the face mask. We won't wear the face mask above the face shield. So face shields are used as PPE in various settings such as hospitals, prisons or other places where the risk of being exposed to bodily fluids and germs in higher than usual. So if germs are in usual means we can't use this face shield. If germs is higher than the usual means we can use this face shield. The clear plastic allows the wearer full visibility and the ability to work like usual. However, it helps keep them safe from the infections. So next PPE is gloves. So gloves are the disposable or non-disposable. It's a disposable means it's a one-time use coverings that protect the hands, and gloves should also be worn by a healthcare workers when there is a risk of transmitting their own body fluids from non-intact skin on their hands to other individuals. So however, gloves should not be worn for routine activities. So we won't wear the gloves anytime. For example, if we are taking the vital signs means we won't wear the gloves, or transferring a client and wheelchair. For this procedure we won't wear the gloves. If this is needed means we want to use. For example, if we are contacting with the blood means we should use on that time. And so this is the steps to wear the gloves. So first we want to remove on glove frame the packaging and inspect it to be sure no pinholes or tears are present in the gloves. And if gloves are ambidextrous, they can be worn on either hand. If not means align the gloves fingers and thumb with the proper hand before the donnings. So third one, inserting the 5 fingers into the cuff and pull the cuff over the wrist and check for a secure fit around the fingers and palm. The cuff should fit snugly around the wrist. What are the purposes to wearing the gloves? Means wear gloves protect against skin absorption of chemicals, chemical burns, thermal burns, laceration and cryogenic liquid exposure. So steps for removing gloves. I will show the picture. So this is the steps for removing the gloves. So first we want to grasp the outside of the one glove near the wrist. Do not touch your skin. So second, peel the glove away from your body, pulling it inside out, and hold the removed gloves in the gloved hand. Put your fingers inside the glove at the top of your wrist and peel off the second glove. So next one is turn the second glove inside out while pulling it away from your body, leaving first gloves inside the second. So after this we want to dispose the gloves. Do not reuse the gloves. Perform hand hygiene immediately after the removing the gloves. So next one is isolation gowns. Isolation gowns are protective garments worn to protect clothing from the splashing or spraying of body fluids, and it reduces the transmission of microorganisms. Isolation gowns can be disposable or it may be reusable. The gowns should have long sleeves with a snug fit at the wrist. Cover both the front and back of the body from the neck to thigh, and it overlap at the back. So gloves should fit over the cuffs of the gown. Gown should fasten at the neck and waist using ties, snaps or velcro. It may be anything. And special care should be taken when removing the gown to prevent contamination of clothing and skin. The front of the gown is always considered to be contaminated. The front of the gown is always considered as a contaminated. So first we want to remove the ties. Ties at the front of the considered contaminated, but ties at the side and the back are considered uncontaminated. So this is the steps. So first we want to dry the hands, pick up the gown, let gown unfold and open to locate sleeves or armholes. Slip arms into the sleeves, hold arms out and slightly up, and last the circulatory nurse pulls gown on. So this is image for wearing gowns. And what is the purpose for wearing gowns? Means they are used to protect the wearer from the spread of disease causing microorganism if the wearer comes in contact with potentially infectious liquid or solid material. And steps for removing gown. So already I told that starting with waist ties, then neck ties, pull the gown forward from the neck ties and roll it so the contaminated outside of the gown is to the inside. So roll off the arms into the bundle, then discard immediately in a manner that minimizes the air disturbance. So this is the pictures. So first we want to remove the ties and remove the armpits and fold it and then discard it and wash the hand immediately after removal. Next PPE is eye protection. Eye protection in healthcare settings includes face shield. Eye protection is nothing but is a face shield. Face shields, visors attached to the mask and goggles that are used to protect the eyes from blood or body fluids. So eye protection should worn by healthcare workers during the patient care when there may be splashing or spraying of body fluids within 6 feet of coughing client. During this time we want to wear our eye protection to prevent the infection from patients. And for example, for the eye protection, when we want to warn, when emptying a urine catheter or assisting a nurse in irrigating a wound or suctioning a client's airway. So for these procedures we want to wear the eye protector. Eye protection can be disposable like face shield or reusable like eye goggles. If eye protection is reusable, it should be cleaned before the reuse. Next one is mask. Masks are protective coverings worn by healthcare providers to protect the mucous membrane of their nose and mouth. So mask will protect the mucous membrane of the nose and mouth. In long-term care settings, masks are typically secured by elastic loops around the ears. So this is the picture. It shown the wearing of mask. So we want to wear the mask like this. And the top edges of the mask as a bendable strip to secure the seal of the mask over the bridges of the nose. So in some situations, require mask to be combined with a face shield or a visors that cover the eyes. And medical mask should be worn when providing care that may cause splashing or spraying of blood or body fluids or within 6 feet of a client who is coughing or has been placed in a droplet precautions. And also medical masks should also be worn by healthcare providers who are coughing to prevent the transmission of exhaled respiratory droplets to clients. And how we want to remove the face mask means like isolation gowns, the front of the mask is considered contaminated. The mask should be removed by taking the ear loop off and placing it in the appropriate disposal area. So it is important to properly remove mask to avoid contamination, to avoid infection to others and ourselves also. Next PPE is shoe cover. Shoe cover is very important in operation theatres. The cover protects the shoe from any liquid or solid materials and also stops any germs or debris on the shoe from contaminating an area. The type of protection required will determine the type of shoe cover that is used. So this is pictures, this shown the shoe cover. The use of disposable shoe covers helps maintain a sterile environment while eliminating the risk of contamination to the clean room and the wearer. So thank you for watching.